Hello everyone, my name is Colleen Parsons. I'm a research associate with Western University. So the title of our project that I'm working on is Transforming Emergency Shelter into Affordable Housing with Support. So on our team is Dr. Abe Oudshoorn, Dr. Carrie Marshall, and Dr. Deanna Befus. I think I got that right. So what are we really looking at here? This is a really important project for me as we're currently experiencing a housing crisis in London. So we found in our literature review that there wasn't a lot of information on what is it like to transform an emergency shelter into affordable housing. We also found in our literature review that there wasn't a lot of information on what is it like to live within a private room within an emergency shelter. So we did a qualitative and quantitative mixed methods approach to our study. And I really like Javid's introduction to his research project, so I'm going to kind of do the same thing. So if everyone can close their eyes and picture yourself driving with your family unit, whatever that may be, and you're in an accident, a very severe accident. You're the only lone survivor of that accident. And you are faced with not only trauma, but you are now faced with physical rehabilitation, you're faced with pain medication, now you have a high tolerance for pain medication, you're doing physio, you can't keep up with finances, you have a lack of support maybe in the community, and all of a sudden you find yourself on the streets. And where do you go? You go to the Center of Hope, you go to the Salvation Army. They open their doors to you. You are now put in a dorm setting with 6 other people. You take your first shower. It is among 7 other people that are taking a shower. It's the first time you've undressed in front of somebody. It's the first time you see a needle in the shower beside you. It's the first time you've had to wake up and stand in line for coffee. Pouring that cream, you're only allowed, 2 creams for your coffee. Well, I like 4 creams and 4 sugars, right? So you're all of a sudden, put in this traumatic scenario where you're not knowing who you are anymore, how to live, and all you really want is privacy. So you can open your eyes now. So what we looked at is, what do these private spaces and these private units mean for people? And they mean so much. So if everyone can just stick out their hand like this and just turn. And that's a locked door, right? You're locking a door. This is something that we really take for granted, right? When we close our door at night. And this simple, gesture or this simple action means so much to people, is just having that private space. We saw an increase in stability, we saw an increase in health, motivation, self-esteem. And so what we did is we produced a short and a long video with individuals that were staying in private rooms, and I wish we could show the videos. I can't wait till they're released. They're really going to touch an emotional piece, I think, for everyone. And so that's the first phase. We're also doing a practice manual on how to transform an emergency shelter from service delivery to affordable housing delivery. And what do those services look like? What does that look like for an emergency shelter, right? We know that we're in a housing crisis. We know that, there's a lot of different bylaws and zoning that kind of limits our ability to create affordable housing, right? So the Center of Hope is doing something really innovative right now, which is creating affordable housing within their shelter. So thanks to them for inviting us in. Also thanks to all the participants we interviewed. They shared their stories with us. It was very enlightening just to know what a locked door meant to people and how much that could really impact someone's health and well-being. So now phase 2 is now the Center of Hope is transforming their second floor into a recovery support center, which is going to include an internet room. It's going to include a physical fitness room, a games room. So something that you touched on, actually, Carrie Ann, is boredom, right? That's a very important factor. So that's what the recovery center is going to transition into. So we're going to be collecting data on that and what that looks like. I did want to mention, though, our funders, because I feel like that's important. And our funders and our collaborators are the Salvation Army, Cressy, as well as the National Housing Strategy Demonstration Initiatives delivered by the CMHC. So through that, I have 14 seconds. We are going to be doing, so we have the 2 videos that are coming out, short and long term, about the positives and negatives and some of the challenges about living in a private room. And we're going to be doing a practice manual so other shelters can incorporate this new model of affordable housing, presentations, workshops, and an instructional website. Okay.